therapeutic consideration, but before going for the treatment plan, I'll just revise them again. For therapeutic consideration, while giving PT management to MND patients, the goals are going to be prevention of disuse atrophy. Now there are going to be two types of atrophies. One is because of the neurological condition that at MND itself. The other is going to be because of the disuse. That because the other muscle is going to be weaker. Suppose for example, girdle muscles are weaker, hand muscles are not used. Hand muscles are weaker, girdle muscles are not used. So these girdle muscles will undergo disuse atrophy or vice versa. So this prevention of your disuse atrophy, and secondly it is going to be the major thing is going to be prevention of overuse injuries, which is again seen because there is going to be asymmetrical and atypical distribution of the muscle weakness. So there is going to be substitution by the stronger muscles. So there are going to be chances that because the stronger muscle is being used frequently, there is going to be overuse, and which leads to overuse injury. So the goals are going to be prevention of disuse atrophy. And second is going to be prevention of overuse injury. Now, disuse atrophy prevention is necessary to prevent further deconditioning. For example, a patient who has got lower limb weakness. If there are few muscles which are going to key muscles which are going to be more than 3, but the other muscles are weaker. Just because of those muscles, the patient is not walking. So there will be further deconditioning. Or if similar to the earlier example, if there is a hand muscle weakness, patient does not use shoulder muscle. So there's going to be deconditioning. So that deconditioning is to be prevented, and so it has to be a structured exercise program which is tailor-made for that patient is to be prescribed. We cannot say that okay, the protocol for physiotherapy is strengthening of the muscles. No, we need to assess the muscle, and that's why I'll repeat it what I said in the last lecture. Assessment is important in every condition, but it is going to be utmost important, especially the IMT is going to be very important in case of MND. So if there are less than 1/3 of the neuron functional, then what is going to happen if you start strengthening, there is going to be more damage to the neurons. The neurons will be injured and you are going to reduce the number of neurons functioning. So if in a muscle there is going to be less than 1/3 of neuron functional, don't strengthen the muscle. If there are going to be more than 1/3, then there are chances of improvement, so strengthen the muscle. If you exercise a muscle for, or it's going to be over, if you use overload principle for a muscle which is having less than 1/3 neurons, meaning the muscle power is arbitrarily less than 3, you are going to harm the patient. So always the muscle testing is very important, and when you are testing the muscle also, please see to it that you do not repeat or do not test it repeatedly, because if the muscle itself is 2 and since you are not confident about your assessment, you are repeatedly doing it, you are going to cause more damage. So this is important while exercising as well as assessing. I'll repeat it. If any muscle is less than grade 3, you are going to cause damage by giving overload principle or using overload principle to that muscle. Whereas if it is more than 3, you can expect improvement. Now, when this is also, I've talked about it last time, I'll just repeat it so that it will go in line with the treatment. Exercises will be directly proportional to the number of muscles fibers spared. So meaning if the muscle has been severely atrophied, I'm not talking about disuse atrophy, I'm talking now about neurological atrophy. If the muscle is been atrophied or severely atrophied, the intensity of exercise should be low. If the muscle is in a good condition, that is more than grade 3, so there is not going to be much of wasting, you can give exercise. So exercise intensity should be directly proportional to the number of muscle fibers spared. This is again, I'm repeating, muscle fibers are going to be less even in case of disuse atrophy. But this I'm not